Now take that and think about how many people are getting drug and alcohol services through the Affordable Care Act in Pennsylvania here. Right now there's over 65,000 people who have access to drug and alcohol services because of the Affordable Care Act. Those are people who have a heroin addiction, people who have alcohol addiction, people who never had health care before in their life. If they repeal the Affordable Care Act, I am going to have to stop providing treatment for all of those people. It took us weeks to get everybody back into care for 8,000 people. Can you imagine what would happen if I had to do it for 65, 70,000 people? Never mind the 700,000 people here in Pennsylvania who have health care for the first time. I get notes all the time, someone saying to me, it's been 30 years, I've worked all 30 years, never had health care insurance. I was one bad illness away from being bankrupt. Now I have health care. Now a bunch of guys in Washington, right, want to tell you that that's a disaster. That's something we have to go through. And after 33, 40 votes, whatever it was, they don't have a single plan in place to replace it. And just me, the bureaucrat that I am, I have to do this on a daily basis, I'll have to send letters and I'll have to tell 700,000 people they don't have health care anymore, right? That is, when you combine that with the people who get Medicare and Medicaid in Pennsylvania, that's 40% of the state. So if you look around you, count 10 people, you're going to be affecting at least 4 of the people standing next to you if you count 10 people. That's how big this is, right? And to me, when I interviewed with the governor for the job, he said, why would you want to do this, right? This job is really tough. And I said, because at the end of the day, there are hundreds of thousands of people in this state who are worse off than I am. And I want the chance to be able to provide a better life for them, give them a better quality of life, and get them health care. And all of us have to stop that from coming down at the end of the day. Not only are we talking about the Affordable Care Act, we're talking about people who want to privatize or put vouchers in for Medicare and Medicaid, right? And maybe that's something you can do when you're sitting in Washington. But when you're seeing these people on a daily basis, I think those folks in Washington should have to be the ones who tell all the people that their health care is going away, or that they can't get the health care that they've had for all this time. That woman who came up to me and said, for 30 years I haven't had health care. Maybe some of those folks in Washington should come down here and tell them, you know what, you don't deserve health care. It's not a right for you, and we should take it away. So I would just say, please, everybody, come to this rally today, but don't just do that. You've got to speak out, because those folks in Washington, not all of them, not like Senator Casey, but some of the folks in Washington, they're getting ready to do that. And they'll pass a vote, they'll move on, and they'll never see all the people they're affecting. So don't